So, also just a reminder that we will be recording this discussion and uploading it on YouTube if anyone wants to share it with anybody later. So, I am super excited for these questions. Dr. Sugarman, I think I'm going to start with a question for you. What are some of the main takeaways that you've gleaned from your time working with immigrants in detention?
I think really the main takeaway is I no longer use the word detention. It is jail, it is a cage. Detention just sounds a little too mild and doesn't really describe the horrors of what people go through. If anybody has been to a jail, even just to get inside to pay a visit, you sit in this waiting room and there are guards everywhere, and you have to jump through all kinds of hoops just to get in. And then as you enter, there's that horrible clanging of the doors. You pass through multiple layers of, the kind of electric doors open, and then they clang shut with that horrible kind of echoey noise. And then you walk down a hallway and the next set of doors opens and clangs shut. And the place is surrounded by barbed wire. So it's just a prison, it's a cage, it's a jail. And the people who I have seen are not there because they're a danger to society. They weren't shooting or stabbing people. They are simply there because they are immigrants. And I have met many people that are here completely legally. It is possible to be locked up in jail simply because you present yourself at a U.S. airport when entering the country, and the customs person says, "Why are you here?" And if the person says, "I'm here to seek asylum," at the point of entry, they can be whisked away and locked up indefinitely without any rights to have a lawyer, unlike they're not eligible for like legal aid or a public defender system. So the inhumanity, and this has been a process, as Sarah can explain better, this has been a process that's been going on for many years, and it's completely inhumane, and there's no justification for it.
Yeah. Yeah, thank you so much for sharing. Okay, and Dr. Katz, we have a question for you as well. So you have led an interesting study about the impact of detention on families. So could you tell us a little bit about that? And then in what ways does detention psychologically affect separated families?
Well, in the summer 2018, we did some research at the Family Detention Center in Dilley, Texas, and we were there to kind of just examine the extent of child mental health issues in the child detainees, and we were, of course, interested in knowing what the impact of detention was on their mental health. By chance, we happened to be there right in the middle of the child separation crisis. So we were able to study some of the reunited kids as well. And what we found, in some sense, wasn't surprising. Sometimes you do research to prove what you know in your heart, but you got to do it to be objective. The kids on the whole had considerable amounts of mental health issues, various general psychiatric issues, some PTSD, post-traumatic stress disorder-like symptoms, and potentially the outright disorder. And they had them on the whole at rates far higher than if you went out in the community here in the States. If you went out here in the community in the States and just looked at Latino kids as well. So we compared them to other populations. They had much higher rates. And not surprisingly, the formerly separated kids had even higher rates than their fellow detainees. Not particularly surprising. We also found that the duration of their separation from their parent actually had no bearing on the likelihood of their developing the mental health issues that we found in them, which we took to mean that just simply being separated in and of itself was very traumatic. The duration, of course, probably added to it, but it didn't really matter. The sheer act of being torn from your parent, for lack of a better word, messed with their minds. So those were the extent of our findings. I forget what your second question was, Riley. I'm sorry.
Basically, we were just And you kind of already answered it, but so in what ways does detention psychologically affect separated
Oh,
families?
yeah. I forgot the question because we didn't really answer that question. Um, we actually we actually studied the ratings of we asked the kids' parents, the mothers, to rate the quality of life in detention, and actually they actually rated it pretty well. So they didn't have many complaints, and we don't know why that is. We have ideas. One is that they thought they had to give us the right answers because they were afraid of us. But we actually are more inclined to think that they came from such horrendous circumstances that even being locked up in detention was, somehow actually preferable to what they came from, which is a little hard to wrap one's mind around. But we weren't able to show any connection between detention and the mental health issues in the kids. But the study really wasn't quite set up to do that anyway, because in order to do that, we would have needed to know about the child mental health issues before detention, and we didn't have that kind of information.
Mhm. Mhm. Okay, thank you. Yeah, thank you for sharing. That's very interesting. Okay, so this is a question for both of you as medical professionals. The films that we watched for this week's film festival, were really unique because they were animation. So that was just a really cool way that the director was able to advocate for immigrants and asylum seekers and those children that had gone through those situations through animation, through his profession. So, how do you view your role as medical professionals in advocating for detained immigrants?
I'm happy to start. So I, I use the prestige that doctors in our country have, the prestige to be a voice for people who, have trouble getting access to, public spaces, media, or whatever. And I started advocating because I realized through Sarah and other lawyers that it became horribly clear that detained people were being denied access to routine medical care. So Sarah knows the first time I think I worked with her was a woman who was just in constant agony and needed surgical interventions and was being denied that. So it was like a medical lens, a medical window into the horrors of being a detained person. So, in the community, if you have a medical problem, if you need chronic medications, if you need surgery, you can access that. But when you're detained, you're completely at the mercy of the ICE jail. And at least the cases I've seen, people were being denied any kind of humane or routine medical or surgical treatment. So through that lens, I was able to amplify and speak with other people about the horrors and the inhumanity of certainly detained people who need medical treatment and are being denied it for no reason other than cruelty.
Yeah, I would second what Dr. Sugarman said about the prestige. I mean, doctors, we're pretty credible on the whole. People trust us. We have a fair amount of authority, and so I mean, this is a case where we can put it to good use. And in particular, I mean, there's evidence shows that when you get a doctor involved in a human rights case, an asylum case, a credible fear case, where somebody is facing deportation. If we get involved and we're able to speak to their credibility in a sense, right? Does, at least as a psychiatrist, does this person who's saying that they were traumatized in this way in their country, do they actually look like someone who's been traumatized? And we have enough experience and training to be able to say that with authority, and we know that does help. That does increase the chances that people will not be removed, and will either pass the credible fear threshold or even be granted asylum down the road. So it's a very nice way to kind of step outside of the traditional doctor role of caring for an individual's health problems and advocating for them within the larger legal system that we have in the United States. It's really, I think, being a doctor as advocate, and it's a very, for me, gratifying feeling to be able to do that.
Yeah, thank you.
And if you think of it, just to add, if somebody, let's say, has post-traumatic stress disorder, I can treat it with medication, psychotherapy. Um, but if they have it and you send them back to the trauma, all the meds and talking therapy in the world isn't going to make a difference. They're probably not even going to have access to it back in their country anyway. Right? Probably the best way to treat it is to actually remove the trauma, or at least to start them on the road to recovery. So that's why it feels so important to do the work.
Yeah, that's
And then just to expand, you've got a traumatized person who has fled the trauma, and then they're being locked up in inhumane conditions, being told, we're going to deport you. You know, you're locked up in this cage, and you're under a deportation order. You're in removal proceedings. Well, what does that do to the trauma? They just ran for their lives, and now we're telling them every day, you know, you're under threat of deportation. And to talk about, I know Dr. Katz wasn't studying this particular, and specifically, I went to an event on behalf of the families at Berks. There's two of the family jails are in Texas, and the third is in Berks County, Pennsylvania. And I went to a Shutdown Berks film event, and people described that you know, it's a family jail that the guards routinely go through every hour, on a close intervals. The guards go through all night long, shining flashlights on everybody, very bright flashlights on everybody. How a person is supposed to get a night's sleep, obviously they can't, but also they said that when people are deported, when people are plucked out of Berks and sent back to their country of origin, they're also taken out and removed from Berks in the middle of the night. So how's anybody ever supposed to get a good night's rest when every hour, you know, bright flashlight beams are shining on their face, knowing that one of those wake up checks, you know, it could be your deportation.
Mm-hmm. Yeah, thank you. Thank you for sharing. That's definitely a terrible situation. And to make things worse, today we're in the midst of a global pandemic. So every day the numbers are rising in ICE detention centers. As of yesterday, there were 2,675 recorded positive total cases in ICE detention. And so, Dr. Sugarman, what are some of the risks that you notice, especially as a medical professional, of being in ICE detention during this pandemic?
Well, if somebody were going to design a perfect setting to spread the infection, get sick and die, it would be a prison. So if you look at any guidelines internationally, you need to social distance, you need to be far away from people unless they're, you know, the family that you live with. You need access to lots of soap and water, you need fresh air. You know, these are the things that we tell people every day. This is what you need to do. You know, so that you don't get infected. So you look at a jail or an ICE jail, and you've got people in very, very, very close quarters, many people sleeping in one room. You know, to make matters much worse, there's a lot of mixing of populations. So you've got the prison staff coming and going every day. You've got the prison food workers. You've got all the people that come and go in a prison from the community, you know, from the community into the prison, then back out. And then you've got this horrific ICE practice of moving the ICE prisoners from one jail to the next. So you can imagine, you know, if you start off with one person in one jail is infected, the other jails are negative, but all the coming and going of the staff, all the transferring of the detainees from one place to the next is just a perfect recipe to get so many people infected, sick, and dying. And to give an example, looks like Sarah's got examples from Texas, but I can give you an example from Farmville, Virginia. In a remote part of Virginia, there's a for-profit ICE jail, the ICA jail in rural Virginia in a town called Farmville. And apparently the people now are just burning up with fever in Farmville. ICE is not even bothering to test them. When people protest, they get physically abused. And, you know, we're just terrified, you know, how many people in Farmville are sick. And then you've got the guards who are going to leave, go home, infect their family members and affect their communities. I think the ACLU is trying to sue against prisons just because prisons in themselves are a risk factor to infecting the entire country. So it's quite scary, and it's you know it's these are now death camps. There's just no other word.
Mhm. Yeah, and from my own personal experience, speaking with detainees, I feel as if they also, there's a lot of confusion. Like they don't have access to information about the virus necessarily. And so this can often lead to a lot more panic. And so I guess I have a question for each of you. So Dr. Sugarman, what is the level of knowledge that most detainees, in your experience, have about the coronavirus? And what do they need to know in order to be safe? And then Dr. Katz, my question for you is psychologically, how does the lack of information amidst a global pandemic affect one's mental health?
So I can't speak for the detainees. Maybe you or Sarah can, having more direct contact with him. Honestly, I don't think there's anything they can do to protect themselves other than to get released, which is not in their hands. But, you know, when you're crammed in with other people who are infected, I don't know if the prison's giving you us, but I know there's no fresh air. I mean, I know there was a prison guard in Elizabeth, New Jersey at a for-profit ICE jail who died. So I don't know what people know. And, you know, they don't have access, you know, even before COVID, they didn't have proper access to soap and water and cleaning. You know, you read prison accounts again and again now that, you know, in the midst of a plague, people still don't have soap and water. People are, I know I've heard of cases in New Jersey, people are crying and screaming for medical attention, and they're not getting it, you know, like sitting in their own vomit. And you know, I'm being quite graphic, but this is, you know, people are talking about, they're just like, you know, covered in their own vomit, and nobody will, you know, help them clean up, have them see get medical care. So um, any level of panic would be completely appropriate.
Mm-hmm.
And as for the question of dealing with the uncertainty, I mean, you have to think about where the detained individuals start from, right? They're fleeing potentially traumatic circumstances. So they already are coming from a frame of mind where trust is a very, very big issue, and uncertainty, and not knowing who they can trust, where life is going to take them, right? And then they come to the States, and the people they think they can trust, lock them up and treat them poorly, right? So they're dealing with even less predictability, an understandable, even further lack of trust in the people around them. And if they actually have something like PTSD, for example, you tend to feel extremely isolated and alone on this earth. And you're in detention, and so you're already feeling alone. You may be separated from your family. And then you throw in the pandemic, where you don't need to be in detention to be, right, scared by the uncertainty about the pandemic. For all of us, you know, because the information is changing, because there's a lot of lack of understanding, and we have access to information. We may have access to too much information, right? And we're out here where we can ask people and check with authorities, and they can't. So to me, it's just adding such a large amount of uncertainty and fear on top of a heaping mound of uncertainty and fear that already existed before.
Mm-hmm. Yeah. And so this is a question more so again about your work experience, and it's just really cool how you guys advocate for detainees and asylum seekers as medical professionals. And so what made you decide to want to do this kind of challenging work, and what made you decide that you wanted to advocate for detainees?
Dr. Katz, I always go first. I'll let you go first.
Okay. You know, I always kind of say that this work kind of found me, because I've been very interested in working with, you know, in low resource communities, people with a lack of access to healthcare and mental health care. I'm very interested in that. And that's where the global health work I do. I have a program where we work in different countries like Liberia, and in different countries in the Caribbean, Haiti, and India. So I'm very interested in improving access to mental health care and serving underserved communities. I'm also very interested in in the system and in the law. I did I trained in something called forensic psychiatry, where you train to learn to use your psychiatric knowledge to help inform the legal system in different ways. And so for me, human rights work was like the perfect combination of all that. Not that I planned it that way. It just, when I learned about it, it seemed like the natural thing for me to be doing, given my various different interests. And I particularly like it because when I do human rights work right here in New York, right, the world comes to me. I don't need to fly to Liberia or to Haiti. The folks come here, and I get to learn about what their world is like, what their culture is like, and at the same time help them find a better life, which is all that they're trying to do. So it's just, for me, it's just a perfect combination of different interests, and a way to try to make a difference in the world that isn't about prescribing medication or conducting psychotherapy, but impacting on people's interaction with the system.
Mm-hmm. Mm-hmm.
Yeah, I guess I had kind of similar happenstance. About 13 years ago, a few people and a few lawyers approached me, and they said, if you document these scars of torture, people have fled torture in their country of origin, if you make a medical document of their scars, it'll really help with their evidence in their asylum hearing. And right, like, do you need to be a doctor to know that a stab wound looks like a stab wound, or that a cigarette burn looks like a cigarette burn? But when it's got, the MD after it, oh, this round, rough scar looks like a cigarette butt, it dramatically helps them. So that's how I entered. It was totally by happenstance. And then, as I was documenting scars, some people, lawyers said, oh, well, I've got a detained client. Can you go into jail and, to an ICE jail and document their scars? So sure. So I learned about the conditions in the ICE jail. And I really think Sarah was my first case where I learned about, it was the woman who had the cesarean section that split open. Her wound from her C-section split open, and she was in agony. And that's when I learned about the world of people being, detained people being denied medical care. So it was just so compelling. And then, I learned about D4CC. It was just about 1 year ago. It was about 11 months ago that D4CC started. And my God, what a brilliant idea that doctors can organize, and as a group in the thousands, we can advocate for the rights of detained people. And then, especially through the New York Lawyers for Public Interest, American Friends Service, other groups, but particularly Mia Soto, who has the Medical Providers Network with the New York Lawyers for Public Interest. We've just got this enormously growing project where we write letters now to try to get detained people, immigrants and non-immigrants, to try to get detained people released before they die from COVID in jail. The evidence shows that, if any person with diabetes, high blood pressure, many other medical conditions, if they have if they are infected with COVID, they have a 12 times greater chance of dying. So we now have a whole core of medical students, physicians, who are writing these get out of jail letters, and we have had some successes. It varies according to state. So it's just a compelling journey. And the worse our country gets, the more compelling is the work. And it's just, I feel like I just have no choice. If somebody's going to die from a preventable death, let me do what I can.
Yeah, that's incredible, how you both use your platform to advocate for people, and it's just awesome. And you are making such an influence in the lives of others and just in our country. And so we're very thankful that you guys have chosen to do that. We have just about 2 minutes left, so I want to wrap up with one question, and it's a loaded question, but if you could sum it up pretty quickly. What would you like to see our government doing differently regarding immigration detention?
Besides ending it?
Yes.
I mean, I think, I think the government should recognize that the individuals that come here have incredible strength. And if you think about everything that they've been through to get themselves here, these are very, very strong, resilient people. And I think our government, rather than thinking of them as intruders and as bad guys or whatever, as people who actually, if we help them, help their health, help their mental health in particular, get them on the right track, they can be incredible contributors to society. And particularly with kids, where if they are traumatized, but they're young enough, you can really change the trajectory of their lives so much by making sure that you address their traumas early on in their life and just put them on a completely different path, rather than just lock them up in detention where we don't know anything about the mental health care that they get. Or then you throw them out of detention and we don't know what kind of follow-up they get. We could really, in a sense, the United States could be using migrants, in a sense, I don't mean this to sound the wrong way, but to our advantage if we treated them differently. And then it would also be very humane.
Exactly. And I don't want to cut off your response, Dr. Sugarman, but we have just a minute before our Zoom call will end. So I just want to say thank you so much for both of you for coming and for talking to us about these things. And thank you all of us for joining us. For more information about the Migrant Center, please visit our website at migrantcenter.org. And you can subscribe to our listserv for updates about ways to get involved. So we're also sending out COVID updates about what's going on in the detention centers. So for more information about that, go ahead and subscribe to our listserv. And we just want to say thank you so much to our panelists and all of our participants. And I hope that everybody has a safe and celebratory 4th of July weekend. So thank you so much for joining us, and we'll see you soon. Bye.
Thank you.
Thank you.